19 अगस्त को डॉक्टर विवेक गुप्ता एक मैसेज देना है समाज के लिए, डॉक्टर्स के लिए, यंग पेशेंट्स के लिए। तो क्रोनिक किडनी पेशेंट्स होते हैं, किडनी जिनकी खराब हो जाती है। डायबिटीज़ पेशेंट में 100 में से 3 या 4 लोगों को क्रोनिक किडनी डिजीज़ होती है। शुरुआत में क्रोनिक किडनी डिजीज़ में हमको डायलिसिस जरूरत नहीं पड़ती, लेकिन अगर किडनी दोनों ही खराब होती, देखिए एक किडनी खराब होने पे कभी डायलिसिस जरूरत नहीं पड़ती। अगर दोनों किडनी खराब हो जाएंगी, यानी कि जो फिल्ट्रेशन काम है, किडनी का काम होता है बॉडी के जो अंदर जो गलत पदार्थ या जहर कह सकते हैं या बैड एलिमेंट्स को रिमूव करना। दैट इज हाउ द यूरिन इज मेड। तो किडनी इज वन ऑफ द वेरी इंपॉर्टेंट फिल्ट्रेशन प्रोसेस विच फिल्टर्स द होल ब्लड and the bad elements are thrown away of the body and the good elements remain there, and this is happening all the time. Kidneys are functioning all 24 hours like heart. जैसे हार्ट काम कर रहा है 24 घंटे, सेम टाइम सेम डे, द किडनीज आर, whenever you take water, extra water goes through the blood and the blood के जो bad elements हैं, यूरिया है, क्रिएटिनिन जो होता है, बेसिक सिस्टम होता है, that is actually it's a filtering system, very important, because if the kidney stop working, then body will have a high urea, high creatinine, and that will lead to acidosis, and finally it will have bad element on the whole blood body. Patient will go into coma and patient will also have cardiac arrest. Patients of kidney disease also have associated coronary artery disease. So whenever we have a kidney patient and we have any doubt of heart disease, we directly do angiography, especially those on dialysis. But in early kidney disease, we want to avoid angiography because sometimes the dye which is given can also exacerbate and cause further deterioration in the kidney function. So we have to be very, it's a razor edge. You have to be very careful what to do. So when the patient on dialysis, we are safe because the kidneys are already damaged, and therefore the heart should not go bad. अगर heart की functioning खराब हो जाती है in a kidney, sometimes lot of patients all over the world they avoid angiography. The patient, not only patient, but doctor also avoid angiography, and then sometime during dialysis, patient may have cardiac arrest. Therefore, it is very important to know about the coronary arteries, especially in kidney patients. To all the patients of CKD who are on dialysis, they have total safety about angiography. Those patients of chronic kidney disease who are not on dialysis, they have high creatinine, on medical treatment, we have to be very judicious whether angiography is actually required. If required, we will use a safe dye, safe contrast. We will load with the patient with the hydration. We will do the hydration of the patient. 3-4 दिन एक्स्ट्रा पानी पिलाते हैं, थोड़ा बहुत एक्स्ट्रा, so that the body milieu is now safe to accept even the safe dye which is Vizipac. This patient has a chronic kidney disease. He had some sort of a chest pain and we did an angiography, and very fortunately the angiography is completely normal. But now this gives us a big relief, not only to the cardiologist but also to the nephrologist कि देखिए, this is the left coronary artery. This is the left circumflex, LAD circumflex. It's a co-dominant system, and all the arteries are almost normal. And in fact, I'm very happy to say that there is not even a single plaquing. There is no plaque. The arteries are absolutely clean. He's a 60-year-old gentleman, and the clean arteries to a normal in a patient who is diabetic. The patient who has kidney disease is having not even a single 10% plaquing. Not even 10% plaquing in a patient who is diabetic, who has a kidney disease on dialysis. So this is the right kidney. We have done, normally we do from the groin, but this patient we have done from the right radial artery. Show this hand दिखाइए, अच्छा बंद कर रखा है इन्होंने। तो we have done from the right radial artery because the left radial we have a fistula. So I want to tell you, a good normal angiography gives आपको 10 साल की फुर्सत हो गई, gives a full relief to the patient and the family and the nephrologist and cardiologist. Thank you very much. Chronic kidney patients, if required, angiography should always be done. One should not defer. I have seen many patients of even angina, even old MI, they don't do angiography because kidney और खराब हो जाएगी, and then they land up with a severe cardiac arrest or cardiomyopathy or poor ejection fraction, and that is more detrimental to the health than doing an angiography and treating it. Dr. Vivek Gupta from Apollo Hospital, New Delhi, on 19th, no, today's 19th of August 2023. Bye bye.